and this here. Okay, and I'll take these two.
Well, like I said,
I got that one.
You got this- you got this one?
No.
Okay, you get five. You got it.
third
Okay, and
Fridays at
put
9
these
a.m.
in the.
Staff meetings are on Fridays at 9 a.m. Yeah, that's a good time. Just the way the schedule is.
And what do you want?
Because we have such extended long hours, we're open till 8 o'clock. Maybe we should. Saturdays,
Oh, yeah.
we'll have a job.
You open on Sundays too? Those are good for a lap blanket, put them in your car. Put them, I guess, this time of year, put them on the sand on the beach.
There you go.
It's like I'm gonna talk like that. You just scroll. Okay,
How large are these? Are they for like one person?
help yourself. One per person.
Oh, okay, I knew how big it was. I didn't want to take two unnecessarily.
I haven't opened them up to see because it's been so hot. I didn't really.
You don't need it.
How about you take one?
Hello.
She takes one. Hi, welcome. Hi.
Do we sign in?
Okay.
Yeah, you can, if you like,
I have handouts. We've got
we've got a lot of handouts and, Debbie will be going through some of the things.
These are awesome.
I'll take the whole pack. Right, and then, an hour later, you want to have some sausages.
Yeah, I've been with Boston for since 1989. This is stationary.
Okay, you were there already. I didn't know how to write it down. Yeah, she was spoiled.
I feel like the community has enough room for all the providers.
Be creative.
Yes, home at Mighty Road.
Whatever, it's not being.
Since they broadcast it too. So I gave a presentation to other providers during COVID, because it was made remote, so I'm sitting here looking at my computer. Because it used to be a meeting where we got together before COVID, and it was sent on my computer, so it's nice to have some faces.
Right. I guess, what do you think, Shelley?
Well, I started this so people could come on, so.
Yeah.
Yeah, people come in, yeah.
Well, good evening, everyone, and welcome to our second program in our series of Special Evening With. Really excited to have my friend Debbie Levin here. I will mention a couple of upcoming activities, and then I'll introduce Ms. Levin. So, July 5th is a big day here at the Lancaster Community Library. At 10 a.m. on July 5th is the start of our semi-annual book sale. And also that day is our annual Author Expo, and that starts at 1 o'clock. We're really excited this year to have as our keynote speaker Kalela Williams from Virginia Humanities. She is head of the Center for the Book and head of the annual festival for the book that happens in Charlottesville. So I hope you will come back. I'm sure some of you will be here before July 5th, but Hope you'll come back on July 5th to take advantage of our book sale and meet about 40 authors from our area. Our next, after this program this evening, our own Shelley Robertson on July 10th will be presenting Scam Alert. So that should be full of very important information that we should all know to stay safe online. So, Debbie Levin is a family nurse practitioner at Bon Secours in Heathsville. She's witnessed firsthand the crisis of diabetes in the Northern Neck. She obtained a certification in advanced diabetes management to help our community. And this evening, we're all going to learn about what diabetes is and how we can easily make healthy lifestyle changes that include building healthy meals and even healthy ways to dine out. So, without further ado.
Thank you. Yeah.
Can you hear me all right? Okay, perfect. Well, there's a lot of confusion out there about different types of diabetes. I've even heard about to diabetes number 5 and all kinds of things. We're going to focus basically on type 1 and type 2 diabetes and how we can do healthy choices and lifestyle changes to hopefully prevent or delay diabetes. So first thing we'll talk about is what is the difference between prediabetes and diabetes. Prediabetes is when your glucose levels are higher than normal, but not enough to turn into type 2 diabetes. So 1 in 3 adults have prediabetes. That's roughly 84 million people. And sometimes you go to your doctor and they'll tell you, you're just on the border here. You have to be careful, right, or it could go all the way to diabetes. So what's going on in our body? Insulin is made from our pancreas, and it's in the beta cell. It's a large gland, and it sits behind the stomach. And it's the key. So think about insulin being the key to unlock the glucose to get into our cells. Our cells need the sugar, the glucose, to function. That helps us to move, energy, our brain, so we need that. When you develop insulin resistance, the body can produce insulin, but it's not as effective getting into the cells. And then the glucose can float around and get in the blood, but it's not getting where it needs to go. So that's what insulin resistance is. There's some good news that if you find out that you have insulin resistance or prediabetes, there are some things that you can do to help persuade your body not to convert over to diabetes. Do any of you know folks that have type 1 diabetes? So folks that have type 1 diabetes, their pancreas is not working. It's not producing insulin. There are some theories that the virus could have caused it, and it usually occurs in children and young adults. When it occurs in older adults, young adults, like in your early 20s, that's what we consider latent diabetes, or LADA. You may have heard that. Type 2 diabetes, our pancreas, as it's developing diabetes, the pancreas will start to shrink. And so the pancreas will shrink about 50%, which is half of its size, of course, and that is leading to the diabetes. It's not pumping out the insulin, and then there's some insulin resistance. And finally, if you have any questions, please don't hesitate during this talk to answer. I'm used to sitting in an exam room, talking to people one-on-one, and I almost want to pull my chair up and just have you all gather around to do that. So please, if you have any questions, don't hesitate. So there are some risk factors that can determine or push us that direction towards diabetes. And so let's take a look at that. So in people, let's talk about first people that don't have diabetes. When you eat food, the food is broken down into sugar, glucose. In response to the increased sugar, your pancreas, beta cells, will be released in a hormone. The beta cells will release a hormone called insulin. Insulin will open the doors to the cells. That's the key. Hi, welcome. To get the sugar to get into the cells and unlock them. They reduce the amount of glucose that's made in your liver. So insulin has opened the door. We all got that, right? Number one, the key, insulin opens the door. And then number two, there are hormones that are developed from your liver, and your liver will also, I'm going to reboot. So without diabetes, your response to increased sugar is your beta cells in the pancreas release a hormone called insulin. Insulin opens the door, think of it as a key, and that allows the glucose, the sugar, to get in and be used as energy. Other hormones that help your body use sugar is amylin and GLP-1. Keep that in mind because we'll talk a little bit about GLP-1 later on in our discussion. So they help reduce the amount of glucose made by your liver. So a question that I get is, I didn't eat anything, and then in the morning I check my blood sugar and my sugar's high. Why is that? Has any of you thought about that? So our body has our liver shooting out extra, we'll call it candy, on a parade grid. So you're sleeping at night, and all of a sudden, you don't have to get up and break, right? Why? Because the brain tells the liver, time to shoot out some alcohol candy on the parade grid. And that also happens in between meals, because sometimes we'll go a long period of time where we won't eat, and because the liver then is bumping up its production and shooting out, throwing out candy on the parade route, then we don't have to eat, and that's why our sugar has gone up. Does that make sense to everybody? So the GLP-1 and the amylin is our body's way of telling the liver to tone it down. I'm not going to talk about a lot of medications, but I want to mention, has anyone been on metformin or heard of someone on metformin? Okay. Metformin is usually one of the first medicines that are prescribed, because what metformin does, it'll tell the liver to calm down and not put out that extra sugar. And so that's why you'll see a lot of people starting on metformin.
Is metformin and Trulicity the same thing?
So Trulicity is the GLP-1, and I'll talk about that. That's a great question. So that's another way it slows down the gut, tells the body to not produce as much, and kind of slows everything down. It also goes into like telling your brain you're not hungry, decreases the food noise. So back to a normal person, no diabetes. So glucose goes out if you need it, and the liver will also shoots it out, and then there's a slow emptying of food in your stomach. Another hormone, glucagon, asks the liver to release stored sugar, and sugar is low. So not only does liver send out the glucose like candy. It's a storage unit for more glucose. So you can see if your liver gets out of control, then your sugar levels can keep going up and up. Any questions so far? So what happens in diabetes? So in type 1, we talked about the pancreas making little or no insulin due to an overactive autoimmune system. Type 1 usually occurs in children and adults, young adults, but it can also appear in older adults too. Type 2, the body may prevent insulin from working right, or it may not make insulin, enough insulin. So let's start talking about some risk factors. Here's the fun part. So being overweight, you may go to your doctor's office or your nurse practitioner provider, and they're saying lose the weight, lose the weight, lose the weight. Because that's a high risk factor, not just for diabetes, but it's also for hypertension, heart attacks, kidney disease. Being over 55 years of age, well, that's something we can't control, right? We want to get over 55 and keep going. So that's one of our risk factors. Having a family history of diabetes. Diabetes is very common. 85 million people pre-diabetes, millions of people diabetic. Our lifestyle, which we're going to talk about, all those factors kind of lean into that. There's also higher risk for ethnic groups such as Native American, African American, Hispanic, or Asian. So we can't change our family tree. We can't change our age. So we have to look at things that we can't change. So how is diabetes diagnosed? One way we can do it is if your fasting blood sugar is 126 or higher. You can also do a glucose tolerance test. A lot of times when ladies are pregnant, they'll have a glucose tolerance test during their pregnancy. And another way that we check is the hemoglobin A1C. And pre-diabetes is 5.7 to 6.4, and anything above 6.4 is diabetes. Have any of y'all had any of these tests done? Some other things that you might notice and things to look for, as we're trying to prevent it, we still need to look, is are we having any symptoms? So over on the table I have some handouts, and you'll see there's a handout on high blood sugar and a handout on low blood sugar, which you're welcome to partake. So if you find that you're very thirsty, needing to use the bathroom to urinate frequently, you're hungry all the time, very sleepy, blurry vision, or you have an infection that's not healing, those are signs that you should seek a provider to get checked. But the other part on the other side of the handout, also, what do you do about a high blood sugar? So you want to follow a healthy eating plan, you want to exercise, you want to drink lots of water. So drinking water will help bring your sugar down. Movement will help bring your sugar down. And then if you are on medicine, then take your medicine as prescribed. Also important though, signs of low blood sugar. may feel shaky, may feel sweaty, dizzy, confused, hungry again, weak and tired, headaches, nervous or upset. And what would you do about that? You would treat that. Usually I'll have patients tell me, I ate something and I felt better. And what we look at is 15 grams of carb and recheck a blood sugar if you're checking your sugars in 15 minutes. So how much is 15 grams? 4 ounces of juice is one way, a couple tablespoons of raisins, 4 ounces of regular soda, glucose tablets, but who carries glucose tablets around? I usually tell folks, take a little bottle of juice or a little box of raisins, something that you can do. And if you're checking your blood sugar, then you would check in 15 minutes to make sure your blood sugar is come back up. I also have a handout over there that talks more about what is diabetes, type 1 and type 2. And it shows a picture. Thank you, Alice, for handing some of those out. It shows a picture of an apple that someone is eating and how it's broken down. And I think if everybody takes a look at that, the little discussion I just had will make a whole lot more sense. But there is something else interesting about food that I want to mention. If everyone in the room had an apple, and we took a bite of the apple about the same size, our blood sugars would not be identical. So the gentleman in the front, he takes a bite of apple, his blood sugar might go up to 120. The young lady sitting next to him of 63 years, congratulations. She may take the bite of apples and hers goes up to 105. Young lady sitting in the back, they take a bite of apple and they go up to 85. However, you do find if you're checking, someone could take pizza, that's their trigger food. Someone else is pasta. Someone else is a piece of cheesecake. So that's why we can't just say, here's a prescribed diet, follow this diet exactly, and it will keep your blood sugars perfect all the time. Because everyone's triggers are different. Okay? So it's important to recognize if your blood sugars are going up too high, they're going down, and our symptoms may be a little different as well. So looking at hemoglobin A1C, what is that test? What is it about? So hemoglobin A1C is an average of what your blood sugar is for the last 3 months. 50% of that test is the previous month that you just experienced, and the other 50% is the other 2 months. And your red blood cells live in your body on an average of 90 days. And so that's where that test is a 3-month average. You don't have to fast for it. And that gives us a lot of good information. So to stay in range, as you can see, you want to try to get that A1C down to about 5.7. But let me also explain another caveat. Age has something to do with it as well. The older you get, the less restrictive you should worry about your blood sugar. So if you're in your 80s, for example, or more, then the blood sugar, the A1C, we're looking at 8.0 as our target versus a 7 or below for everybody else. Okay? An 8.0 means 183 average blood sugar or less. So my older folks, I'd like them to be 170, 180, try to keep them away from 200 or above. because as you get older, your body doesn't have to have that type of control. We don't want them to get lightheaded, shaky, and dizzy. But some folks, some patients, they'll say, my blood sugar, if I go below 100, I don't feel good. I need to keep it, above 100. And then I have other people that I deal with, patients, and they'll say, I don't want a low sugar, so I make sure I eat and keep my sugar way up. Well, you want to find a good balance. So you're 80 and above, 8.0, that's the level we want, and 170, 180. The rest of us, 7 or below is where we want to be. And the reason we came up with the hemoglobin A1C of 7 is studies have shown that you want to have least complications. You've heard of like people blindness, having foot ulcers or amputations. They've done studies and found that if we can keep our A1C 7 below, in that neighborhood, there's a higher, it's better for us than going up higher into the 7s, 8s, 9s, etc. There's a higher risk of those complications. So far, so good. I know it's a lot of information, and it's, the serious stuff here. So. Okay. Now that we've talked about all the things that we want to avoid, right? Let's start talking about impacts on our health that can make a big difference. Losing extra weight. It is hard to lose weight. So the American Diabetes Association recommends that people lose about 5 to 7% of their body weight to help to prevent diabetes. So losing weight is 10 to 15 pounds. We all think about, that slim, I want to be a model. If your body will just say thank you if you lose 10 to 15 pounds. It's a huge difference in your health. The Diabetes Prevention Program, they did a randomized trial, 58% reduction of the incidence of diabetes over 3 years in subjects that were treated with intensive lifestyle interventions. 58%. That's more than 50-50. It's almost 60%. That's huge. So what can we do? Well, set a goal. Set a weight goal. Don't make it that, I'm going to lose all this weight in the next 30 days. A pound or 2 a week. And set realistic goals. Look at your current body weight. I usually tell folks try to lose a pound or 2 a week. That would be the goal there. Be more physically active. Instead of me talking all the time, let me ask you all, we go around the room, what type of activities, what type of physical activities do y'all like to do? You want to start?
Walking. Aerobics.
Aerobics, walking.
And the house cleaning.
Oh, house cleaning, absolutely. Alice, what do you like to do?
Oh, I like to walk, and working in this big building helps me to walk quite a bit. And it's nice to have the park across the street for good weather.
That is the big advantage with the library, having the park right across the street. How about this beautiful lady right behind you?
Basketball.
What do you like to do?
Basketball.
Uh-huh.
I do the exercise in the chairs with the red band. I like doing that.
Oh, awesome. Yeah, so if you're sitting at a desk job or you're sitting a lot for whatever reason, exercise with the bands. That's awesome. How about you?
Well, I like to dance, but I these days I'm walking and doing yard work.
Mm-hmm.
We walk around, exercise together, gardening, swimming.
So walking the dogs, gardening, swimming, walking at work, using the dance, they're all awesome ideas. And let's see what my next slide, if that reflected what we were talking about. Yeah. Aerobic activity, strength training with the bands. So how much exercise should we look at to do? Start small, but let's have a goal. 60 minutes a day. Oh my gosh, how are we going to do that? Well, let's think about it. When's a good time to exercise or get that activity in? After you eat a meal. How do you feel? You feel sleepy, right? Tired? Because you just fed your body, the glucose levels went up. But if you get up and you walk around for 10 or 15 minutes after you eat, studies show that glucose gets into the cells. It unlocks it, gets it into the cells. So if you're eating 3 meals a day and you exercise or walk around for 10 or 15 minutes, and then you're taking the dogs for a walk in the evening, all of a sudden, look at that, you've got 60 minutes. Isn't that amazing? And you won't feel as sluggish or tired. So that's really good too. The other thing we should do is sit less. Of course, if you sit less, a lot of us, how many of you do a lot of sitting? Yes, me too. Yes, I'm in my office, I see the patient in the exam room, and I go back to my office, back and forth. When I worked in the hospital as a nurse, I was up and down the halls constantly. I did a lot of exercise walking. So that was a transition. So think about that. Some people have a desk where they stand, so they're standing more. So that's also another healthy habit. So now that we talked about activity, let's talk about eating healthy. We already talked about different foods can be triggers for different people. Plant foods are healthier and fiber-rich foods because they make your digestive system work. And it also helps clean out the digestive system. Carbohydrates, which turn to sugar and starches, provide energy. But if you think about it, how much food and energy do you need? And that's where we're going to get into portion control. So we have some fiber-rich foods such as fruits, tomatoes, peppers, fruits from the trees. And if we're going to pick vegetables, non-starchy vegetables are the way to go for the majority of what vegetables you're eating. So those are like green leafy vegetables, broccoli, and cauliflower. But why would those be better than carrots and peas? Just think about it. Yeah. Carrots and peas will turn to sugar faster than broccoli and cauliflower. So, once again, it's portion. Doesn't mean there's food. You can eat any food you want to eat. Even a type 1 diabetic, which I'll go into. But it's your portion control of how much you can have. How much your body, let's put it this way, how much your body needs versus how much you can have, how much your body needs. So legumes are good, whole grains, such as wheat, pasta bread, whole grain rice, oats, quinoa. Eating healthy continued, we're going to eat healthy fats. You want to avoid carbohydrates that are high in calories, those are empty calories. Unsaturated fats promote heart health and vascular health. Examples of healthy fats: avocados, olives, sunflower, cottonseed, and canola oil. Nuts and seeds such as almonds, peanuts, flaxseed, and pumpkin seeds. There's healthy fish, fatty fish such as salmon, mackerel, sardines, tuna, and cod. So So we have some fad diets out there. Have y'all, anybody tried those? No? Oh, I'm so proud. Yes? Which ones have you tried?
Keto,
Keto?
green smoothie, Atkins.
You tried them all. Okay, gotcha. Weight Watchers? Did you
Yep,
know
I
them
tried that too.
too? Mm-hmm. Okay. So, as you mentioned, paleo, keto. So, did you lose weight on them?
Yes, but there, some of them weren't sustainable. And then others, like the green smoothie diet,
Yeah.
it caused like severe headaches because you're not getting everything you need. So it, you lose weight, but not without side effects.
Right. And you lose the weight, then you stop the fad diet, what happens?
And it comes right back.
And sometimes it comes back more.
Mm-hmm.
Because our body is still used to holding on to that extra weight. Back in the cave days when we didn't know what our next meal was, we would go around scourging for food and putting on, the weight. Our bodies learn to store the fat, right? And a lot of it stored stomach, right? Legs, backside. Okay. So you want to make choices that are healthy, and that's a good way to either prevent diabetes or at least delay it. Because when your family has a very strong history of diabetes, that's when you really need to be paying attention. And the younger we start, the better, but believe me, whenever you start, it's 100% your body will be happy. Don't ever think it's too late, can't do this. If you start right away, your body will be happy. So, what I recommend to patients is the plate method. And then I have a couple things to help with food that are on the table. 2 handouts. One is called Building a Balanced Meal. And the other one is reading nutrition labels, reading the labels. How to interpret that. So you take your 9-inch plate, which Alice is going to hand some of those out, and it will show you how to start that. So you start with your 9-inch plate, and half of your plate are those vegetables that we talked about. The non-starchy vegetables. And this particular sample, it's got broccoli, it's got mushrooms, it's got some lettuce, and then a third of your plate is protein. That's about the size of your palm. So like a piece of chicken, a piece of fish, a pork chop, and then the other third would be your carbs. So you divide your plate out, you start with your vegetables, then you add your starches or your grains, and then you want to add your protein, and it gives you some samples. And then what you see on the side is you also want to make sure you're keeping up your fluids, right? So whether it's iced tea or water, you want to make sure that you have a low-calorie drink like water or unsweetened tea. And then you can add your fats. And inside, you have basically a template that you can fill in. So you can make some samples for breakfast, lunch, and dinner. Also, the cornerstones prepare is from a pharmaceutical company, so I'm not saying go with this pharmaceutical company. But it does have more information, and it has a picture of a little lady in a red apron with the rolling pin. You can call in or go online and order, and that book will break down how much a serving size is. So it's really helpful for planning meals. Even if you're not carb counting, it'll help you with portions. Okay? How many of you, when you go to the grocery store, look at the labels? Okay, a lot of you do, that's fantastic. So you want to start with the nutrition facts and look at the serving size. It may have three, like this one can has 3.5 servings, but a half a cup is the serving size. But we tend to look and go, okay, this quart a can, right? And all of a sudden you've had almost 4 servings just by using that. You want to look at your calories, your total fat, look at your cholesterol and sodium, look at your carbohydrates, 18 grams. So 18 grams, remember, carbohydrates from the sugar. So some of you may have your provider say, want you on a 65-gram carb diet for the day. Break that down and go, how many carbs is that per meal? Is that sustainable? Is that something I can do? So that's something you would work out with your provider. As promised, we're going to talk about dining out. That's very popular down here, right? We've got all these good restaurants and places to eat. So if you are diabetic, you would want to stay with eating around the time that you take your medicines. If you're not diabetic, you probably still want to eat on not a rigid schedule, but a sort of a set schedule that your body is ready for the food, so that you're not saying one day I'm going to eat breakfast at 9, another day I'm going to eat breakfast at 7. Very confusing for your body's glycemic index, your up and down of your blood sugars. You'll feel better if you eat on a more regular basis, on a more of a schedule. When you go to the restaurants, you want to avoid a time when it's not too busy. You can also review the menu online. Have you all done that? I like to see what they have, right? Be aware of the hidden fats and carbs. Something crispy, fried, cream, that's going to be extra creamed, Alfredo or gratin, battered, breaded. That's going to be higher in calories and higher in fat. If your prescriber told you about doing a low salt, and you want to, of course, ask about if there's no added salt. Sometimes they have a lot of salt in the kitchen. You can ask for your gravies and salad dressings on the side so that you can control how much is on your salad, for example. Okay. You also want to look for steamed, grilled, broiled. Don't hesitate to, make your own flavor, experiment a little bit to see what tastes good to you. Here's another thing that's important. You want to keep the same portions that you would eat at home. And that's what a lot of us don't do. A lot of us will go to the restaurant and whatever's stuff on our plate, we're going to eat it, right? There is something called a takeout box, so you can take it home and enjoy it later. So let's think about that. Your portions. You can estimate your portions just like this plate method we just talked about. And I've seen this with Weight Watchers too. ADA, American Diabetic Association, Diabetes Association, recommend that you dip your fork in the sauce or the dressing and then pierce your food to eat it. I say if that works for you, that's great. If not, you can pour how much you want on it instead of it, drowning in salad dressing. Try to limit your alcohol and sugary drinks. And when it's time to go home, as I mentioned, make sure you get that takeout container. So anytime you're looking at the grocery store, go back to this little handout. Start with your calories. Look at the serving size, number one. Start with your calories and your total fat, check out your sodium, check out your carbohydrates, how much fiber's in it. Fiber's gonna make you feel fuller. Check your sugars and your protein. Any questions?
You say added sugars.
Yes. And when you go somewhere and it says sugar-free, look on the label and see how many carbs is in there. Because sometimes you're thinking, oh, well, this is a sugar-free cookie. I can eat the whole container. But it's full of carbs that turn into sugar. And then all of a sudden your blood glucose levels go sky high, right? I did want to mention too, because I said, if nothing's off limits with diabetes, it's portion control. You could take someone that's a type 1 diabetic who is not making any insulin, right? They're not making any. They have to have a pump or they have to inject themselves. They could take, I had a patient say, I can have a piece of cheesecake. They'll take a piece of the width of their finger, and that's about 2 or 3 bites, and they know that that is all the cheesecake they can have. Now, do they do that every day? No. I'll tell you, how many of y'all like ice cream or love ice cream? Yeah. You can have ice cream every so often, but not ice cream every single day, every night before I go to bed type of thing, because that's too much. So yes, you can have it, but it's portion control. You have to regulate. Okay, when to see your provider. So the American Diabetes Association recommends routine screening to diagnose type 2 diabetes for all adults 35 years and older. The ADA also recommends screening for the following groups: people under 35 who carry excess weight and have one or more of the risk factors that we talked about earlier. Women who've had gestational diabetes, there's about a 15% chance they can develop diabetes. People who have prediabetes. Children who carry excess weight and who have a family history of type 2 diabetes and other risk factors. Because unfortunately, we are starting to see some children developing type 2 diabetes because of those risk factors that we're talking about. So especially if you have diabetes, be an active participant in your care. But I say, even if you don't have diabetes, please be an active participant in your care. Set individual goals with your provider. Just like we talked about, everyone eating a bite of apple could have a different level. Know your A1C and daily blood glucose levels if you're diabetic, if you're checking. You could also, if you were curious and wanted to know, you could get a continuous glucose monitor. It's called a Stello. That is, you don't need a prescription for. Like I said, I'm not promoting any pharmaceutical company, but you could get a Stello, wear that, and it would give you an idea of how your blood sugars are running. If you are pre-diabetic or diabetic, especially if you're on insulin, you should be on a continuous glucose monitor. It's recommended. If we can get it through insurance, that's what I recommend. If not, you're sticking your finger a lot more than you want to, right? Okay. Also, you want to manage your blood pressure, 130 over 80 or less. And remember, as we get older, our arteries get stiffer. So sometimes as we're getting older, our blood pressure, the top number will go up more, and that's okay. Manage your cholesterol. Get an eye exam every year if you're diabetic, at least 2 years if you're not. Another important thing, because your feet are the furthest away, right? We're always worried about the feet with diabetes, because just like when we'll talk about the eye exam, little blood vessels, little nerves, the feet is further away from the center of the body. We have to watch your feet, check your feet every day if you're diabetic, check for cuts, for poor healing, and that's critical. So your feet checked daily for any sign of cuts, blisters, or cracks. And don't go barefoot if you're diabetic because you can lose sensation, get more of a tendency to lose sensation called neuropathy, and you could step on a piece of glass outside or something, not feel it, and all of a sudden you look down, there's blood on the sidewalk. So that's important. Let's see. Also, we want to keep your blood glucose at a great level to help preserve your kidneys as well. Go to the dentist, get your immunizations, and if you're on medications, take them as prescribed. Questions? I know it's a lot of information. Anything anyone wants to share? Any tips?
So I do have a question about diet, whether or not you're diabetic. So is everyone kind of different about what they need to eat to make themselves healthy?
Okay, so you want to stay with the basic food groups and eat a good balance. The Mediterranean diet has been the most scientifically proved healthiest diet. And time again, every year it always wins the award of being the healthiest lifestyle to eat. You'll also, the plate method is a good way to sort of eyeball it and say, all right, am I getting my vegetables? I'm getting a small amount of carbs, and my protein, a little fruit, and some dairy on the side. Stay hydrated, very important. So those are the key things with diet. Everyone's a little different, just like those sugar foods. That's the main reason I can't say, here's the perfect diet for you. You eat exactly this and you'll be healthy forever. But great question.
Thank you. I'm thinking in particular, usually between my husband and I, he likes to eat a lot more meat than I do. And I don't know if that's a taste preference or is it a health preference.
It could be not necessarily even, it may be a craving that his body is looking for more carbs.
Oh.
So sometimes you'll have a craving. Everybody has cravings sometimes. I'm gonna start on this side of the room. What's the craving you sometimes have? Depends on the day. Do you start your day out with coffee or no? Okay. Okay. How about back here?
Sometimes I'll want sweets. Not so much
Now,
now.
could you do the microphone if you don't mind? Oh, not just bring them, because I've got the air back here or something. Thank you.
Sometimes I'll want sweets, but I'm getting fewer cravings now that I'm eating better.
Coffee.
Coffee.
I have to have coffee.
Get your day going. Do you drink a lot of coffee all day?
No, it's just the one cup.
Uh-huh.
Yeah, it's just the one cup. I can't drink coffee all day. I'll be up all night.
Okay, that's fine. How about the folks in the front?
No.
She's coming around with the microphone.
Okay, this isn't gonna go over too well, but, I noticed it talks about protein, and I'm always talking about chicken. I'm always saying, oh, I can make, chicken tonight, and he goes, chicken again? And I'm like, well, yeah, that's the number one thing here is chicken. We do eat a lot of tuna and salmon and eggs, but there's so many good chicken.
Chicken is so versatile, right? You can do a lot of things with chicken.
There's nothing wrong with it, it's good for it.
Yeah. As long as you're not deep frying it all
Oh,
the
yeah, but
time,
we
you
don't,
know?
yeah, we
You
don't.
gotta watch how you prepare it.
Yeah, yeah.
I mean, fats tend to taste good, but they're not as good for us.
We steam,
Uh-huh.
we steam chicken
Mhm.
a lot. You just put it in a big, like a roaster for turkey,
Uh-huh.
put the pieces in there, the water on the bottom, the lid on, 15 minutes or so,
Mhm.
you have the chicken.
Perfect. Now I have a question for the audience. Show of hands if you want to participate. How many of you have an air fryer? How many of you use your air fryer? Yeah, so that's another really nice way to put some fried type foods that make them healthier is to cook them and not heat up the kitchen, right? You don't want to do that. The air fryer does that. So that's another good tip with cooking. And then in here, see if I brought it over here. Okay. I promised that I would talk to you for a minute about the GLP-1. There was a question about GLP-1, and I do have a handout. GLP-1 does occur naturally in our body, and the pancreas makes that. So the pancreas is an interesting organ. It has beta cells and alpha cells, and these GLP-1s. And basically, the pancreas, as I mentioned, gets smaller. Different parts of the body contribute to the progression. It also includes the gut. You may have been hearing about gut health, right? Has anyone heard about the probiotics and biotics, the gut health? Well, basically the GLP-1, how that medicine works is it works on the brain. It takes away some of the food noise. So it works on the center of the brain that makes us feel hungry, feel full, saying the opposite. So it makes us feel full, and then we don't want to eat as much. It also slows down the digestion so that the food that we did eat stays in our system longer, and then that also makes us not eat as much. And so those are the key things that the GLP-1s and these semaglutides do, is they work on the brain center, because you could be sitting there at a Thanksgiving meal or all your favorite foods on the table, and someone's on Ozempic, which you're listening, and you're like, oh, I can't eat anymore. Because it gets rid of the food noise, and it slows your gut down enough to say, I'm eating a few bites and I'm done. And that's how that medicine works. That's the key on how that works. The tricky part though is getting insurance coverage and all of those other, qualifying for it, and the insurance is the factors on those. Because I have probably a couple times a day, several times a week, people coming in for like weight management and then get all these shots, and it's you have to qualify for them. So I would tell people, again, questions about your medicines, call your insurance first to see what's on your formulary, and also start tracking what you're doing. Even if you do that for 2 or 3 weeks, write down, what am I eating? How much am I drinking? How much exercise am I getting? It's almost like, hey, we're back in school, but you'll be surprised to look at what you've been doing and go, well, if I drank a little more water, if I got up and moved around after I ate, these things will help you in your goals. Any further questions? Any other questions?
Just eating more slowly when you eat, is that a good idea?
I think eating more slowly when you eat is good because you're not bringing in as much air. And then some people have gastric reflux or GERD, and so that will help with that. Sitting up after you eat, after we get that satiated feeling and we want to go put our feet up and watch a movie or take a nap, getting up and moving around, or at least sitting up, maybe doing some of those chair exercises we were talking about, those would be beneficial. Any other questions? Yes, ma'am.
This might be a little silly, but the
Hours
building.
and I'll put you back on the
Oh,
mic
sorry.
again. Thank you.
This might be a little silly, but the building a balanced meal, normally I try to think of things in terms of veggies first and then
I'm
fruit.
closer too. I feel like I'm up there lecturing all the time. Hi.
I normally think of the plate as vegetables first, protein second, and then carbs.
Uh-huh.
Third, is there any particular reason why they're doing carbs second?
Basically, I think they're just trying to emphasize that a third of your plate is carbs. I think they're not saying you have to put it in that order, but they had to put it in some type of order on the handout. And so they wanted you to think of vegetables first, because that's healthiest, and then your carbs and your proteins and the additions to your plate. Does that help?
Yeah.
Yeah.
And last question, this is a lot of information you've given us.
Yes.
Is it possible to get a copy of it?
Yes, so it's gonna be on the site, right?
The
She's asking
presentation,
about
yes.
the slides and the information.
On the YouTube channel.
The presentation will be, I have your copy of the PowerPoint slides. Will you allow them to be shareable at the end, because they're not very visible on the video? Because we're more concerned with who's in here at the point. But would you allow them to be shareable at the end for
Yeah,
them to
sure.
click through? Okay, then yes,
Absolutely.
yeah, okay, we always just ask.
Yeah. I feel so good being out here with y'all. But like I said, I'm used to sitting in a room and we're in an exam room talking and such.
I love this one about the budget, like, it's so cool.
And also, there are blankets and socks, handouts. Please help yourself. Make sure you get at least one or two, take with you. Okay? Thank you all again for your attention.
Debbie, anyone
Here, turn it back over to Alice.
Thank you. Oh, well, thank you all for coming. And I know we'll see you all soon back at the library, and hope to see you at some of our future upcoming events. If you'd like more information, we do have several flyers on the table. And please do take some socks and some blankets. Courtesy of Bonds House. Yes. And thank you, Shelley, for making it possible to have an online presence.
Round of applause for Shelley.
Thank you, Shelley.